Hello lifesavers, welcome to my YouTube channel, and in today's video I'll be discussing the fascinating topic of pulse points and how to measure your heart rate. Whether you're a healthcare professional, a fitness enthusiast, or just curious about the human body, understanding pulse points is essential. So I'm going to start with the definition of what a pulse is. And the pulse is the bounding of arterial blood flow that is palpable at various points on the body. And the reason why healthcare providers assess and measure pulse points is because it provides information about a client's state of health and influences diagnostic reasoning and clinical decision making. The pulse is an important indicator of the status of the circulatory system. Any artery can be assessed for pulse rate, but the radial artery is commonly used because it is easily palpated. When a patient's condition suddenly worsens, the carotid artery is a recommended site for quickly finding a pulse. There are 10 major pulse points that are taught in nursing school, and the 10 major pulse points are temporal, carotid, apical, brachial, radial, ulnar, femoral, dorsalis pedis, popliteal, and posterior tibial. Let's talk about the location of each pulse point. The temporal pulse is located over the temporal bone of head, above and lateral to the eye. The carotid pulse is located along medial edge of sternocleidomastoid muscle in the neck. The brachial pulse is located in the groove between the biceps and triceps muscles at antecubital fossa. The radial pulse is located on the radial or thumb side of forearm at the wrist. The ulnar pulse is located on the ulnar side of forearm at the wrist, basically the opposite side of the radial pulse or the thumb. The femoral pulse is located below inguinal ligament, midway between symphysis pubis and anterior superior iliac spine. In more simpler terms, it's basically on your upper thigh, in between your groin crease, and between the pubic bone. Simpler terms. The dorsalis pedis pulse is located along top of the foot between extension tendons of the great toe and next toe, basically in between your big toe. The popliteal pulse is located behind the knee in popliteal fossa. Simply terms, behind the knee. And finally, the posterior tibial is located on the inner side of the ankle below medial malleus lutz. Look, this all are tongue twisters, like, I don't understand. Lastly, we're going to look at when it is appropriate to assess each of these pulse sites. The temporal pulse is usually assessed in the diagnosis of temporal arteritis. The carotid pulse is usually assessed during physiological shock or cardiac arrest when other sites are not palpable. The apical pulse is assessed when the radial pulse can be palpated. For example, if the radial pulse is irregular. The brachial pulse provides status of circulation to the lower arm, and that's why it's used to auscultate blood pressure. The radial pulse is a common site to assess peripheral pulse and status of circulation to the hand. The ulnar pulse is also used to assess the status of circulation to the hand, and it's also used to perform the Allen's test, which is a test for patency of radial artery. Much like the carotid pulse, the femoral pulse is also assessed during physiological shock or cardiac arrest when other sites are not palpable. It is also assessed for the status of circulation to the leg. The popliteal pulse is used to assess the status of circulation to the lower leg, while the posterior tibial and the dorsalis pedis are both used to assess the status of circulation to the foot. Note: in infants or young children, it is best to assess the brachial or apical pulse because other peripheral pulses are deep and difficult to palpate accurately. Assessment of other peripheral pulse sites, such as the popliteal or femoral, is unnecessary in routine measurements of vital signs. These alternative peripheral pulses are assessed during a complete physical examination when surgery or treatment has impaired blood flow to a body part or when a patient has clinical indications of impaired peripheral blood flow. And that's all for today's video. Don't forget to like, subscribe, and share.